Does this part or this part of your shin hurt when you're running or playing sports? If this sounds like you may have something called shin splints, or in medical terms, MTSS, which stands for Medial Tibial Stress Syndrome. Shin splints, or MTSS, typically presents itself as pain and tenderness along the upper outer part of your shin bone or the lower inside part of your shin, depending on which type of shin splints you have. This is because there are actually two types of shin splints, and we categorize them as either anterior shin splints for the upper outer part of your shin or posterior shin splints for the lower inside part of your shin. The basic strategies, stretches, and exercises on how to fix these two types of shin splints can be quite similar. So for now, this first video on treatment for shin splints will be my overall basic yet comprehensive guide where I group all these exercises together. But if you want a more detailed shin splint treatment video where I show you my favorite ways to tackle fixing either anterior shin splints or posterior shin splints, let me know down in the comments below so I can break that down further for you in a future video with a more detailed overview for each type of shin splints with more advanced treatment and exercises to specifically treat each type. And perhaps I can also include specific taping techniques that I like to use for my clients, as well as teaching you more targeted stretches and exercises that I find to be the most helpful for each type of shin splints. But for now, I will go over the basics and show you my go-to strategies, stretches, and exercises to fix shin splints so we can finally get rid of shin splints permanently. To make sure shin splints don't come back to haunt us after we fix a problem, we need to understand what causes shin splints in the first place. Shin splints, or MTSS, is an overuse injury which can stem from repetitive activities like running and jumping, or sports that involve running and jumping. The pain that you feel from shin splints is usually from excessive and repeated tension on the muscles pulling on its attachment to the bone, making the periosteum that attaches the muscles to the bones inflamed and painful, and can even be sensitive to the touch. Typically, what causes shin splints in the first place is the common phrase of doing things too fast too soon, or too much too soon. Some risk factors that predispose us to developing shin splints can be from increasing training volume or intensity too quickly, running on uneven surfaces that your body isn't used to, having poor running technique, which can include overstriding excessively, landing too hard and too loudly repeatedly, poor hip stability on landing causing excessive rotational forces in the knees and ankles, being overweight, or even wearing inadequate or worn out shoes. Those are just some of the many other potential risk factors for developing shin splints. And as we said earlier, shin splints are an overuse injury, so the increased load from those risk factors tend to increase the pulling of the muscles on the bone. And it is the excessive repetitions and forces that can cause this frustrating pain and inflammation on our shins. So to prevent the dreaded and frustrating pain on our shins, it is never too late to start doing these exercises to keep your shins happy so you never ever have to feel shin pain. Let's dive straight into this comprehensive guide to fixing shin splints once and for all in a logical and systematic way. So here is a brief outline. First, we're going to relax the tight muscles around the area that can be pulling on the periosteum and our bone, causing the inflammation and pain on our shin. Then we will strengthen the relevant muscles to allow our lower legs to handle the forces we want to place on it to allow us to continue running or playing our favorite sports and do the activities that we love. To do this, we will start with slow and controlled exercises and end up with more advanced exercises to prepare us to return to running or our favorite sports again. The first thing we're going to do is self-myofascial release on our tibialis anterior muscle. We're going to use a foam roller to do this outside of our shin bone here. So we want to be slightly at an angle, aim there, and then you want to find a spot where it's a little bit tender. Hold it there for about 30 seconds. Once 30 seconds is up, move it up just slightly, and you're going to hold it there again for 30 seconds. If there are lots of spots that's tender, feel free to move up the entire muscle all along here with the foam roller and releasing it for 30 seconds at each spot. Then we move on to doing the tibialis anterior muscle static stretch. For this one, we want to be kneeling. Sit your bum down onto your heels, and then you're going to do it one side at a time. Pull that knee up, keeping the foot on the ground to feel that stretch down your shin again. So hold it for 30 seconds, pull it up as high as you need, and then you can do the other side, pull it up, keeping the foot on the ground. So the third exercise is the gastroc stretch, and my favorite one is the lunge gastroc stretch. So basically you're in a lunge like that, and you're essentially stretching this muscle right here And you want the toes to be pointing the same direction. Hold it right there. Next, we're going to stretch the soleus. So for this one, all you have to do is go a little bit closer and then bend the back knee. So when you're doing this one, you're going to feel that stretch at the bottom, lower into that calf. So for both of these stretches, you want to hold it for about 45 seconds, and you can do that twice. So next we're going to go into strengthening our ankle complex. So to strengthen our tibialis anterior, if you have something solid to attach it to, that's probably the best way to go about it. Tie a loop around something solid, and what you're going to be doing is what we call ankle dorsiflexions. Pull the ankle towards you and come back down slow and control. This is essentially what the tibialis anterior muscle does. Ankle dorsiflexion. Pull it towards you, keeping the knee straight. Come back down, pull it, come back down, and pull, come back down. Try your best to work the full range of motion with this exercise. If you don't have something where you can easily attach the band to, just step on that loop band, and then pull your toe towards you, same thing. So pull, back down, pull, back down. So for this exercise, the banded ankle dorsiflexion, aim for about 3 sets of 15. Next, we're gonna go into strengthening our calf muscles. So the first one is just going to be a gastro off the step calf raise. So you wanna hold on to something, come down, and come all the way up. Come down, all the way up. Push off of the big toe, don't roll out to the side, like that, don't roll out. So go straight up. If it's too easy, feel free to do it on one leg, like that, like so. So next, we're gonna strengthen our soleus muscle, and to do that, we have to bend our knee. Bending our knee, and you're gonna go straight up into that calf raise. So with this one, try your best not to go forward, and you're gonna go straight up, keeping your knee slightly bent. Again, if it's too easy, do it with one leg, still going straight up. With the calf raises, you want to do 3 sets of 15 for each of those calf raises I demonstrated. Lastly, after all of that, you want to be doing plyometric work depending on what kind of sports or what kind of activities you want to return to. If you're a runner, you definitely want to be doing the plyometric work, which is the explosive power that you want to train and get back to running or sports that you love. I like the bilateral pogo hops, so essentially you're just hopping up and down. When you're doing that, you want to pull your toes towards you, and you want to be as light as you can and as fast as you can, like that. And if that's too easy, do it on one leg. So same thing, pull your toes up and go as light and fast as you can. So you want to do that for 30 seconds each set, and you want to do 3 to 4 sets of that. Well, thank you so much for staying to the end of this video. If you enjoyed the content, please show your support and hit the like button below, and subscribe if you want to see more of me in future videos. Otherwise, I wish to see you all in my next video. Thanks for watching.